Hi there. Welcome. Good afternoon. It's day 30 of the SBAM daily briefing. Tuesday, April 21. It is day 29 of the Stay Home, Stay Safe executive order. Just want to remind you that part of what we're trying to accomplish here is just to keep small businesses in Michigan as up to date as we possibly can. This daily briefing is one of the ways we're doing that. Another of the ways is our website. I'm a little biased, but I think SBAM at sbam.org//COVID is the best curated site for small business in Michigan right now. We're working every single day to keep it up to date and organized and curated. So I invite you to continue to use SBAM at sbam.org as a resource. Each day, Brian Kelly and I do this briefing. If you've become accustomed to seeing Brian in his car, you will not be disappointed today. But he has put on a jacket, and I think he's done so because we have a special guest today. So I'm going to turn it to Brian to introduce her.
Yes, so I'm in the same setting in my car by the freeway to get a better cell signal. But this is what you call minimum basic operations, Governor. So I have, but I did put on a jacket because we have such a special guest. I wanted to get right to Governor Whitmer and just give you a couple of minutes to share whatever it is that you'd like to share, and then we've got a few follow-up questions for you as well. But as I turn it over to you, I just want to say high compliments to a few members of your staff in particular that have been very responsive. Jeff Donofrio, Ed Duggan, Emily Laidlaw, Jennifer Flood. Just these are tough times. Everybody's so busy, and they take time to respond and answer small business. So I just wanted to say that as I turn it over to you.
Thanks, Brian. And I'm glad for the explanation because I saw you do this in your car the other day and I wondered what the deal was. So now I got it. Well, thank you, Rob. Thanks, Millen and the SBAM, all of the membership. I am glad to be here with all of you. I think that this is obviously a moment that none of us could have ever imagined that we would be in. It is unprecedented. We've got a challenge before us. We are doing everything we can to rise to that challenge, to save lives in the process and make very thoughtful, strategic decisions about how and when it's safe to start to re-engage and what that looks like. I think that, we've spent the last 6 weeks in a posture that we couldn't have imagined. And I know that small business has been hit hard and that it's been a tough time. I've got a good friend of mine who is one of your members who was sharing with me the fears of losing everything that she spent a lifetime to build and the employees that she's worried about. And, I recognize how difficult this moment is and the anxiety, and it is something that I think about every single day that we are in this posture. I know that there are people that are hurting, people that are isolated, business owners that are worried, and employees who don't know if they're going to have a job when we do start to re-engage our economy. And I in all of these conversations, I hope that I'm conveying that we are eager, all of us, to be able to start to re-engage at the earliest moment that it's safe to do so, taking in all of the information that we can so that decisions are based on science and fact and strategic about mitigating risk so that we can ramp up, but do so in a way that avoids a second wave. What we know is that in other countries, and anyone who's studied kind of the 1918 flu pandemic knows that engaging too early or in too robust a way can lead to a second wave, and it can be even more deadly and more devastating economically. And that's something that whether or not you've agree with every action we've taken, I think we can all agree we do not want that to happen. So I simply wanted to first acknowledge lots of small businesses have stepped up to help us through this crisis. PPE was something that was incredibly hard to come by early on. The national stockpile was nowhere near able to meet needs. And so we started contracting around the world to supplement what we were getting from the national stockpile. And Michigan business stepped up turning from the production of alcohol in our distilleries to hand sanitizer. We now have 3.5 million pieces of PPE that came from private donations. And a few weeks ago, we had less than a day's worth of PPE in our Southeast Michigan hospitals. Our procurement office has done an incredible amount, but we've also been able to support small businesses to retool to start producing PPE. And I acknowledged a number of them yesterday in my press conference. This is how we've been able to get to a point where we're maybe 8 to 21 days worth of PPE in our hospitals. And that's a massive improvement. Other states are calling us to find out how we did it. And small business is an important part of the solution that we have come to appreciate here in Michigan. Now, with regard to the economic crisis that we're all facing, I know that we all have a vested interest in making sure we get this right. As we are navigating and trying to determine what the waves look like for re-engagement, it's being driven by a lot of different factors that go into determining amount of risk. Questions like, is the business primarily done inside or outside? What is the interaction with the general public in the day-to-day actions of the business? Is it primarily in an office setting, or is it face-to-face with people? Are there tools of the trade that are used by more than one person, or pieces of machinery that are? And so that's just three of a lot of questions that we're asking so that we can score the risk that is associated with different aspects of our economy. We're also looking geographically what's happening in Michigan. Now, the stay-home order is working by and large. We are seeing that we've pushed down the curve. We've saved lives in the process. We've kept our health systems afloat, which was, the biggest concern early on. We are seeing concerning numbers crop up in different parts of rural Michigan that we are keeping our eye on, because we can't let any of that get out of control, because our hospitals in those areas just aren't equipped to handle a massive number of COVID-19 patients. But as we are looking and assessing regional risk on top of all these other factors, we are very mindful of how important it is that you're able to have notice, that you're able to understand the protocols and expectations of businesses that do re-engage. And so all of this rigorous work is being done. As we get closer, I will anticipate that we'll be sharing more information so you can understand the thought process and why the decisions were made that have been. This has been a tough time. And even on the hardest days, and there have been some tough days these last 6 weeks, even on the hardest days, there are sources of inspiration all across our state. And that's what feeds my soul when I read about a 5-year-old who died from COVID-19 yesterday in Detroit, is talking to the colleagues of her mom and dad who are public servants, who are wanting to support the family by doing a drive-by instead of a funeral. I mean, that's some of the toughest stuff that is going on. I don't ever want to minimize the experience that small businesses confronting. I want to make sure that as we're making decisions moving forward, we're supporting your ability to get back on your feet in a way that you can have confidence is safe for you and your employees and the public that you serve. So thanks for opening up a conversation today. I'm glad to be here with all of you and looking forward to making sure I stay focused on what's on your mind. So let's open it up.
Great. Well, thank you, Governor. Thanks again for coming on. And Jim Colangelo at DTMB, by the way, has been outstanding on getting the connections for PPE. I know that we've got a lot of small businesses that have been a part of that, including some on our own board, Stormy Cromer, who's making face masks now, as a pretty famous example. Now, as we move forward, looking ahead toward May 1st and all the things that happen between now and then, we're pretty familiar with some of the work that's happening with the Michigan Economic Recovery Council, and of course, our board chair, Milind Gandhi, is on that, a part of that group. But as we move toward recommendations being made, are those really the basis of is that the basis of the work that you'll be considering? And between now and May 1st, would you expect that we'd know ahead of time what is going to happen May 1st, or would we probably find out on May 1st how it's going to be?
No, the goal is to make sure that we are laying the groundwork well in advance of it. Obviously, we are writing rules that have never been written before in a very short period of time under incredible circumstances where we need a lot of information. And so I'm grateful for all the contributions of SBAM and Millens in terms of helping to inform the work that we're doing. Our goal is to really to start laying out the factual basis for how decisions were made and communicating them in advance of the 28th. Date timelines fluctuate right now because obviously every single day we're getting more data, we're getting more PPE, we're ramping up on our testing. If I can get those swabs, I can double the number of tests that we're doing literally overnight, but we just don't have something as simple as a swab. And that's not just an issue here in Michigan, it's across the globe really, but across the country. So there are a lot of factors that will go into making the determination what these waves look like, but we will be communicating them in advance so there will be a little bit of time to make preparations. I just want to temper assumptions that, on May 1st, it's not going to be like it was on March 9th, the day before we had our first 2 positive cases. It's not, we're all going to jump right back in. We're going to have to be very, ramping up and be nimble enough to know, okay, if this is working and the numbers still look good, let's take the next step. And it's not going to be a finite date. It could be maybe 2 weeks, maybe it's a week, but we have to really be looking at what the numbers bear out. And if COVID cases start to ratchet up, we might have to be able to pull back from one step to the next. And so I just share that with you because I don't want to create an expectation that the whole world's going to be able to resume as we were, because that's not going to be the case for quite a while.
Yeah, Governor, thank you for coming and spending this time with us. And just to that point, I think we have recognized, or we've been even anticipating, this will come back in stages or phases, and that even the workplace is going to be different when we first come back. And that there's going to be some responsibility for small businesses to, to be a part of this response. And they're going to be asked to do things they've never had to do before. Health screenings of employees, PPE in the workplace. I guess what we've been wondering is what do you think will be the state's stance here? I mean, helping small businesses to help in this situation will require their ability to get PPE, their ability to understand the rules and follow those rules. Just to have maybe even a checklist of expectations of small businesses. I think what we're seeing is they're ready and they're willing to play their role, and we certainly are willing to be a partner in this whole thing, helping small businesses play their part. What do you see coming from the state, I guess, is the question there.
Yeah, no, I appreciate that question because, I know that there's a real view, in my administration that small business knows how to run their business better than the state government does. And yet we also know that for consumer confidence and for employee confidence, people need to believe that it's safe to return to some of these businesses. And so what we have been finding is that there has been a desire for us to really kind of promulgate best practices and to have that written into some sort of a regulation. And so this is kind of the push-pull that we're trying to navigate so that we are giving you the kind of guidance so that you're able to make decisions and make investments that really do promote the safety in your workplace, but also without being heavy-handed big government telling you precisely what you need to do. And I think that's a little bit of the balance that we're trying to straddle here. I've talked to, I've been talking pretty regularly with the heads of the big three, and they have global presence, and so they've got a different experience, and they know what ramping up has looked like in different parts of the world after COVID-19. And yet they also know that in order to get their employees to come back, their employees have to feel safe. And working with the state to really say what makes a workspace safe is something that they are, wanting to work very closely with. And I think that's going to be the case. We got to give people confidence that it's okay to come back out, and it's okay to go back into businesses, and it's okay to show up to work. And so I just recognize this, and I've encouraged business owners to really think through, the type of work that you're doing and the actions that you can take to enhance your protocols, whether it's the cleaning of your workspaces, or it is the wearing of cloth masks that you can procure now in anticipation of what that looks like. The queuing, if you have a business where people come in and to buy something, to limiting how many people are in a space at a given time. I think the public will take a lot of, comfort in seeing that small business also is taking a lead in promulgating very conservative best practices, so that we can start to earn back confidence of the people again too.
So, Governor, the final question here, because I know that your time is basically up. We were delighted to see this regional approach and the communication and cooperation with other governors, but especially Ohio, Indiana, and Wisconsin that directly border our state, knowing both competitive issues, integrated supply chains, workforce that travels back and forth across borders, all the things that our border communities really have to think a lot about. What if you could share just a little bit of insight and some final thoughts on how that operationally, how that plays out, this communication with the other governors and other states, and what that really means for us here?
Yeah, well, one of the things that, in this moment, there aren't many people that are in the same position that I am, that can appreciate all the different stakeholders and the pressures and the economic pressures, as well as the healthcare concerns. And it's been really nice to have other governors that I can talk to regularly. So when I, as I said, each executive order, it weighs heavily. When we pull kids out of schools, that's 1.5 million kids who aren't getting the education they need, half of whom are eligible for free or reduced lunch. So they're not going to get the meals they've come to rely on Monday through Friday. When we close bars and make restaurants dine out, those are businesses that are going to worry about reopening, and those are laid off employees, and on and on. And so one of the things that I did early on was really develop some good relationships with my fellow governors, so that we can talk things through and understand thought process and share information. When I pulled the kids out of school, JB Pritzker was the first to jump on the phone and call me and say, what's your thought process? What do you know? Why are you doing this? What are your concerns? How are you going to work through that? When we were coming upon St. Patrick's Day, and we saw those lines of students at the bars, and Ohio closed their bars and restaurants, and Illinois did. I got on the phone with Mike DeWine in Ohio and Pritzker in Illinois and said, what are your thought processes? What do you know? What are you thinking about? How's this going to work? And so it's been really helpful to have that kind of a dialogue, especially with people on both sides of the aisle, because I don't want to, I need to take in as much information and learn as much as we can in the moment. And so talking with this group of governors, I had suggested, let's build a consortium. We started doing some purchasing together when we were trying to obtain PPE, but we formalized it this past week to say, we've got a lot of similarities. We've got a lot of the same concerns. We're going to navigate this together and share information along the way. It doesn't mean every decision I make is going to be replicated in these other 6 states, or every decision they make in Kentucky is going to be replicated here. But it does mean as we are going forward, we're continuously talking, our teams are talking. So we're making a lot of the same, we're taking a lot of the same information so we can move forward. It's nice to be able to have the U of M right here in Michigan, but also I've got access now to Cleveland Clinic. I've got access to Mayo, because of all of these Midwestern states coming together and sharing our intel. And I think it's really going to help us make better informed decisions.
Governor, we thank you so much for spending this time with us today. And we don't envy the decisions you have to make. We thank you so much for hearing this voice of small business and understanding that, every day people are deciding they can't make it any further. And so we appreciate the balance that you're taking to this. And thanks for spending a little time with us today.
Thank you. Thank you.
Thanks.
So one of the things we've talked about here is the Michigan Economic Recovery Council, just mentioned in the conversation with the governor, and Milan Gandhi, the chairman of our board, has been serving on that council and meeting on every 2 times a week and really digging in. Milan is joining us. Milan, what's going on with the Merck?
Yeah, thanks, Rob. So as I think I was on last week, and I talked a little bit about the MERC, the Michigan Economic Recovery Council. So the members of this council are the CEOs of the 14 largest employers in the state, as well as Rory Gamble from the UAW and Ron Bieber from the AFL-CIO. So getting a labor perspective. And the idea is that, and then of course SBAM, and I represent SBAM on the council. The idea is that we need to get together as a business community, large, small, and labor, and come up with a set of recommendations that we can give to the governor on how and when to reopen the economy. And particularly, okay, we can reopen, but we, as the governor mentioned, we have to make sure that our employees actually want to come back to work. And so we are attempting to self-govern or recommend a self-governance that we can comply with and that will be responsible to our employees and our customers. I will say that we are moving at a lightning speed. It is very fast-paced. We have a set of consultants from McKinsey who are helping to keep the train moving. University of Michigan Public Health Department has given us 4 of their senior faculty to help supplement our ideas with real data. I want to speak about 2 things in particular with this committee that came up on last night's call. Again, we do meet twice a week. Of course, I say meet by phone, and they are intense conversations. There is a full participation rate from everybody on this council. They're not sending in, the VP of whatever. It truly is the CEO of General Motors and Stryker and Dow and all the others, Quicken Loans. And something that has come up is not only do we need to have best practices in place for PPE and cleaning practices and all that, but also a supply chain to get those things. Right now, my personal family business, we are a critical infrastructure healthcare business, and we've had some difficulty, though we're able to get what we need in terms of PPE, gloves, masks, cleaning supplies, etc. But imagine if a few million people go back to work and everybody's competing for the same stuff. Not to mention we'll be competing against hospitals who truly need it for people's lives and healthcare. So we are trying to build a strategy around that to centralize purchasing in some way. SBAM will likely play a role in that to centralize purchasing of PPE for small businesses, but to also make sure, or at least recommend, that the requirements for businesses to reopen who are not healthcare businesses are not the same PPE that the hospitals need, so that we're not competing with them. So we're trying to be really thoughtful about the types of masks and the types of cleaning supplies that we recommend the governor put in place for businesses to reopen. The other thing I want to emphasize is that, as the governor mentioned, this is not going to be like flipping a switch. And if she does, order certain businesses to reopen or allow them to reopen on May 1st, it's not like everybody's going to be back to full capacity. A couple of the large employers on this council have indicated that if May 1st is the date, they expect to be at 10% capacity and 10% of their employees coming back on May 1st, and that they won't get up to 60-70% of their employees till maybe after a month or 2. And if you think about it, if an auto plant ramps down and has ramped down, it doesn't just ramp back up on the first day. And if your job is the 15th part of the assembly line, you don't have anything to do until the 15th day or whatever. So there will be a ramping up process, but also the demand for a lot of these goods and services is down globally. And so they don't need to make as many cars or whatever it is right away. And then the last thing I'll say is that we have fantastic data from members of the council who have facilities in Wuhan, China, and Torino, Italy, that have been operating through this. And they have great data on, once they put in place these safety practices, gloves, masks, cleaning supplies, temperature checks, etc., the rate of infection and communicable disease spread went way, way, way down, like substantially down. And what's interesting is I remember at the beginning of all of this, everybody said, well, unless you have an N95 mask, no mask does anything. And that we have learned is false. Any mask, putting a t-shirt over your mouth and nose, keeps you from spreading to others. And if everybody wears them, nobody can spread it to each other. So there's great case study data on factory workers who did test positive and the 20 people who worked right around them for hours a day not being positive subsequently as they studied the progression because of the PPE in place as well as the cleaning processes.
Millen, I'm going to find the right way to express this to you at some point, but I am so glad that you are the chairman of the board of the Small Business Association of Michigan right now, and sitting at that table and contributing and being the voice for small business. So thank you for doing it. Thanks for leading us. Brian, I want
very kind of you to say, but let me also say that it, to me, is so important that SBAM not only has a seat at this table and that small business is heard when it comes to formulating a reopen and a reentry to the economy, but that our governor is actually listening and that she's here today taking our feedback from SBAM as well as from the Economic Recovery Council, and that, you know, the idea that she's just trying to keep everybody home and shut the economy down, it's not like she gets anything out of this. You know, she's not really winning on this, and she's trying to keep everybody safe. And I appreciate the fact that business and government have a great partnership going right now, and I hope we can keep it going.
All right, thank you. I do want to spend a couple minutes just kind of catching up on things. You know, we continue to talk about the PPE, or I'm sorry, the PPP, the Paycheck Protection Program, and whether or not the Congress will put some more money behind that. Brian, let me turn it to you for the latest.
Get myself off mute. So we do have a, we saw last night after midnight appeared to be a deal on a lot of the details. So we think that as early as perhaps this afternoon, we'll see some action in the Senate, and then tomorrow in the House. So they're moving quickly. Now I have become a little bit concerned though that now as all the banks have kind of, they got everybody in line, they've gotten a lot more efficient, that this money might go fast too. I mean, I think the average loan size is going to be smaller, but we have this many more banks that are processing them. It's going to be more people can get through. That's good, but it also means you're going to have to be on your toes. So I would recommend you call your bank and like make sure that they are ready. Have them guarantee to you that they are ready on day one, because you're not gonna, I don't think there's going to be a huge window here on getting through. A lot of pent up demand for this, but it can be about $300 billion, so it's not an insignificant number. A little less than half of eligible payroll made it through the process here in Michigan last time. So you know, doubling the size is going to be of it is important, but it's also important that we have a higher success rate on people getting through here in our state.
Absolutely, and that's going to take our banks and non-bank institutions and others, and really getting the word out to small businesses everywhere in our state. So let's also talk quickly about the executive order that expired today that had to do with the unemployment insurance experience. What do you know about that?
Yeah, I had some indication. That actually doesn't expire till midnight tonight. But okay. We do think that I've had some pretty positive assurance that's going to be that's going to be extended before the day is out. So if you have laid people off, the experience doesn't count against you right now. I thought, let me just really quickly touch through a couple things. I just want to do a quick recap on some of the things I heard from the governor that is important. I wanted to pull out and make sure that you heard, because we heard some pretty encouraging things, and I was listening very closely. First is she talked about a regional approach. Right? Remember when I said that it seemed like everybody's talking about a regional approach and this one size fits all statewide, but that for the shutdown, yes, but in terms of reopening, a regional approach. We heard a lot about risk factors and risk-based decisions, assessing risk on different types of professions. The example of outdoor versus indoor type of professions was mentioned. So that's another bit of encouragement that the risk inherent in a job is going to be a factor. We heard that we heard her directly say, look, small businesses know how to run their business. That's what the governor said. And that means that, and that was in the context, though, of not being overly prescriptive in what you need to do. So in other words, you're going to be looking for outcomes, and there's going to be a lot of different ways that these outcomes can be achieved. And then that these rules, that what's going to be expected will be, we're going to know those before May 1st. Another important aspect. We don't want to wait until you can open up to know what you have to do to open up, in case there's work that there is going to be work that you have to do to prepare for it. And then on PPE, we heard very closely, or very specifically, she was talking about, for example, with masks, cloth-based masks, which means that the idea of drawing down medical grade equipment doesn't sound like that's likely to be a requirement. So those are all things I pulled out of that conversation and the comments that the governor made that I think bode well for the coming weeks here as we try to get back into more economic activity.
All right, thank you, Brian. As we kind of close out today, actually, Brian and I were in a conversation earlier today with a physician from the University of Michigan who said, if shutting down the economy is an amputation, bringing it back is brain surgery. And I thought probably an apt description of how difficult it will be to bring it back effectively, not go into a second spike. And so thanks for joining us today. Actually, tomorrow we have Bob Riney, the president and COO of Henry Ford Health System, is going to join us, give us that sort of perspective from a major health system COO. And I think he will have some interesting things to say. And on Thursday, I just want to give you a little preview. We're going to have Sheryl Sandberg, who is the COO of Facebook, the author of the book Lean In, is going to join us Thursday to talk a little bit about something Facebook is doing to help small businesses.
Yeah, we can't announce what they're doing, though.
We won't. All right. Thanks for joining us. Remember to wash your hands.
And don't touch your face. See you tomorrow, everybody.
Thanks, everybody.